Good afternoon, everybody. It's good to be back. I begin today with some good news, some incredible news, in fact. 80,000 New Zealanders got a vaccine yesterday, by far the biggest day that we've had since we started rolling out the vaccine in New Zealand. So a big thank you to those being vaccinated, those doing the vaccination, and all those working behind the scenes to make sure the vaccinations can happen safely under Alert Level 4. We also saw record testing numbers yesterday. Nearly 50,000 across the country, so thank you to everybody who's persevering and being patient, making sure they're getting their test. Every test that is processed helps us to understand and to track the virus so that we can knock it out. From today, if you're over 30, you can book in to get your vaccine. This is quite a shift towards one of our larger groups who have a very important role to play in keeping us all safe. I want to stress how important it is that we all get vaccinated. Nobody wants to be in lockdown, and the best way that we can return to enjoying the freedoms that we have had for much of the last year is to get very high levels of vaccination. So we do need to shift from things like our border restrictions and lockdown measures being our main lines of defence to vaccination being a much bigger collective defence against the virus. The 30 to 39 age band includes around 700,000 New Zealanders. I know a good proportion of them had a good laugh at my expense over the last few days, so my message to you is if you had a good laugh, I only ask that you pay me back by going and getting vaccinated. You can go online to bookmyvaccine.nz or call the COVID vaccination healthline on 0800 28 29 26. For the daily update, I'll now hand over to the man with the legendary poker face, Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. Right, so today we are reporting 63 new confirmed cases since 9 o'clock yesterday morning. Of these, 62 were in the community and one is a recent returnee in managed isolation. This brings the total number associated with this outbreak to 210 cases. That is in the Auckland community outbreak. Of these, 198 are in Auckland and 12 are in Wellington. That's an increase of one case, as you will know, on yesterday's number for Wellington. This is, again, another close contact of one of our existing cases. There are currently 12 people in hospital with COVID-19, an increase of 3 since yesterday. 11 of these are associated with the current outbreak. None of those involved in the outbreak are in ICU. So with our current outbreak, the numbers again have gone up to 63 today, or actually 62 with the outbreak, and that's an increase of 48 from 48 yesterday. The good thing about this is, while this is steady growth, it is not exponential. We do know that our actions to slow and spread the virus will begin to see a slowing of those numbers increasing, and indeed the fact that the rate of increase is not exponential is explicitly because we have Alert Level 4 in place. Contact tracing, isolation, community testing and genomic tracing together with our wastewater testing are powerful tools to help us identify the extent of the outbreak, but the most important thing to control it is that people abide by the Alert Level 4 restrictions. At present, the majority of the links between cases are within households or workplaces. There are some cases that are identified who have been at a location of interest. In the vast majority of cases already, we are able to identify that link, and the exact person-to-person link is still being elaborated. As I said yesterday, a large proportion of the cases in the outbreak are of Samoan ethnicity. So I would like to reiterate my shout out of yesterday to the Samoan and Pacifica community in Auckland and to their community leaders for stepping up to support the contact tracing, identification, isolation, testing and vaccination efforts in the local community. Whaafitai, thank you. And as I pointed out yesterday, right since the start of this pandemic, it is our Pacific communities that have had the highest testing rates of any ethnicity, and particularly in our outbreaks, we see their testing rates go up very high, so they're incredibly responsive to the request to get tested. There are currently 6 epidemiologically linked subclusters identified within the outbreak. The two largest ones, as I talked about yesterday, are named Birkdale Social Cluster, associated with Case A, approximately 36 cases, and the cluster associated with the IOG Church in Mangere, approximately 105 confirmed cases now. The other clusters are under 10, and so I won't be releasing any names or details about those. Actually, there is one other associated with a set of Massey households and workplaces that has, from recollection, 14 cases, but the rest are all under 10. There are now even more locations of interest, and those currently being added are generally supermarkets more recently, some other locations of interest. My understanding is there were just over 40 locations of interest added today, and if you think about the large number of new cases, that's clearly a much smaller number than we have seen in other days. As a result of public interest, and as we've done in the past, we are now publishing on the ministry website the demographic breakdown of the cluster, including gender, ethnicity and age group breakdown. That will be updated daily on our website. The number of contacts increases again, as we would expect, and commensurate with our broad approach we have taken to identifying contacts. As of 9 a.m. this morning, there were 20,383 individual contacts that have been formally identified. 12,717 of those there has been formal contact made with at 9 a.m. this morning, and 62% of those had already returned a test result. We now have a much larger number of contact tracers. 380 were trained yesterday from across government, and so in total, within the next couple of days, we'll have over 1,200 contact tracers in call centres around the country. Testing continues across Auckland today with 22 community testing centres. 4 of those are restricted ones, and they are designed to specifically prioritise and test people involved in some of our larger clusters. There's a new pop-up testing centre today in Mountford Park in Manurewa, and that will further increase the testing in South Auckland and make more testing more accessible to the Pukekohe High School community. Testing, of course, continues across our general practices and urgent care clinics in Auckland and around the Motu, and I do want to shout out again to our colleagues in general practice doing all that testing. Wherever you get a test, it is free. On wastewater, there was a further detection of COVID-19 in wastewater in Warkworth a day or two back, and so there is pop-up testing running again today in Warkworth. I've had some message I just didn't get a chance to look at from one of our GPs in Warkworth just before I came down, and they're doing a lot of testing up there. My understanding was 6% of the local community had already been tested before today, which is a great effort. Wastewater samples around the country from more than 70 locations have been analysed or are currently being analysed, covering an estimated 3.6 million people. Aside from the known wastewater results in Auckland, Warkworth and Wellington, there are no other positive wastewater results, including from the 5 sites in the Coromandel. On the Pacific community, back to that again, you would have seen, many of you, a tweet from the ministry yesterday identify that there are some racist remarks and comments being directed at the people in our Samoan community affected by the current outbreak, and this is disappointing and frankly gutless. I'm asking everyone in the country to be kind. The virus is the problem, not people. People are the solution. Be part of the solution. There's a tremendous amount of work going on with this community, and as we have seen in past outbreaks, they're incredibly responsive, and I want to thank all the community leaders who are supporting our efforts to reach out and ensure that we support and look after that community and identify any cases there, which will be to everyone's benefit. Just around contacts of cases, just the rules around exercise. Anyone who is a contact or who is of a known case or who has been at a place of interest should be at home, and you cannot leave your property to exercise. However, household members who may be staying in the home are able to leave the property to exercise as long as they avoid contacts with others and they do not have symptoms. The Minister, I know, will give some more detail on the vaccine rollout. So 2 other areas I'd just like to cover. One is we are introducing a day 6 test in managed isolation. In the first instance, we are doing that on floors where there has been a case identified either at day 0 or day 3. All the returnees on that same floor whose room is in the vicinity of that case will undergo an additional test at around day 6 or 7. That is in addition to other routine tests. It's just to help us ensure that if there is any spread within a facility, we might detect that earlier than waiting right for the day 12 test. And finally, I've just been briefed on the team before I came down on the incident around the possibility of some people receiving saline instead of the Pfizer vaccine at the Highbrook vaccination site. This occurred on the 12th of July, and there were 732 people vaccinated that day. At the end of the day, at that time, there was a reconciliation process of all the vials, and there was found one vial left over that could have been interpreted that some people did not receive the vaccine that day. It's only a possibility. It's not clear that anyone received just a dose of saline rather than vaccine. So there's been a lot of work that's happened since. In the first instance, immediate protocol changes were made to move on all sites to more frequent checking and reconciliation of vials, rather than leaving this to the end of the day. Then have been affected. Secondly, there are labels now put on syringes once they have been drawn up. That's happening everywhere in our large sites. Another thing that's been done is only one vial at a time is taken into the place for drawing up. We've been seeking expert advice on this because, recalling that this was mid-July that it happened, at that point in time there was no discussion around the country, around the world, around the use of booster or third shots. And this vaccine, the Pfizer vaccine here in New Zealand and everywhere, is approved as a 2-dose regimen. So in this case, where it's not clear that we had some people, a small number, possibly 5, who hadn't received a dose, most of those people would have received a dose. So we've been seeking advice from our technical advisory group on what's the best approach to whether or not people are offered a further dose. Again, I just want to reiterate that it's still not clear that anybody missed out, and if anyone did, it would be 5 of that those 732 people who are also scheduled to, and some may already have had a second dose. There's been a full updated review of the evidence going on, including talking to and looking at the experience in Israel, where they have started in some groups doing a third dose. And also there was a similar incident in Queensland, and so we've been talking to counterparts there. Finally, just to summarise what will happen now is that everyone who was involved in that incident will receive a letter within the next 24 hours, and there will be further follow-up discussions with them about what the next steps will be. And again, we're still waiting on the advice of our clinicians and scientists about whether everyone should be offered that third dose or not. But we will keep you updated as that scientific advice comes to hand. Thanks, Minister.
Thank you, Dr. Bloomfield. I'm going to provide a bit more information about vaccines, some information, important information for schools, parents and students, and then a brief word on Parliament. At the moment, we are bringing on board more primary healthcare facilities into the vaccination program. We're bringing on board about 50 per week. By the end of October, above the clinics being the people that they trust, their doctor and their primary care providers. So we're making it as easy as possible for those primary care providers to come on board. We've roughly halved the amount of time it takes to bring them on board into the vaccine program. We've streamlined the way that they are reimbursed for the costs associated with the vaccine program, and we do expect that number to continue to grow. It is free for everybody to get a vaccine, and there will be no charges for the vaccine for anybody in New Zealand. Our specific drive to ensure essential workers are vaccinated is also tracking well. We've seen more than 6,500 essential workers get access to the Pfizer vaccine. Just over the last week. Feedback's been extremely positive from supermarkets in particular. They want to make sure that their staff are protected at alert level 4, and we're working with them to ensure that that can happen. From tomorrow, all government border workers are required to be vaccinated. There'll be checks and balances in place to ensure that that happens. That's the first of two deadlines we have in place. By the end of September, the wider border workforce who weren't covered by the first required vaccination order for border workers will also need to be vaccinated. These further measures will again strengthen our border requirements and strengthen our protections against COVID-19. To quickly remind you of the daily numbers, 2,932,455 doses of the vaccine have been delivered so far. Over 1 million of those have been in Auckland, so over a third of the doses of vaccine that have been delivered so far have been in the Auckland region. A quick word on education. Some of you may or may not have tuned into the Education Select Committee this morning, where I spoke about the education system's response to COVID-19. We do know that learning from home puts a huge amount of strain on students, on parents, on teachers and on educational leaders. So I want to send a big shout out of thanks to everybody that's involved in ensuring our young people's education continues whilst they are at home at alert level 4. We do know that it can be difficult and stressful for teachers in particular, and so we have put in place extra support for teachers through the Employment Assistance Program that's available from today. It is free of charge, and more information is being distributed about that. We do know that if teachers are feeling the strain of that, they need to talk that through with someone. We want to make sure they can do that. That's available free of charge from today. I've also heard that many schools are making use of the public health order that enables a small number of staff to go on site to get the devices and packs of material to send out to students. Thank you for doing that, and thank you for doing it so carefully and safely. We've made funding available to the Ministry of Education so that they can support schools and kura to meet the costs of providing materials to young people whilst they're learning from home. We're also making sure that learning packs are available centrally where schools are unable to produce them themselves. And we are also particularly focused on getting digital devices out to the young people who need them. So around 7,000 devices should go out in the next few weeks. That's on top of the 36,000 digital devices that we sent out last year. Live education TV has been reactivated, both on TVNZ and Māori TV. That comes on stream from today, and there is also on-demand content online. We'll continue to work to connect households to the internet that aren't connected to the internet where they have learners in them. Finally, a word on Parliament. Select committees are meeting this week to ensure the ongoing scrutiny of government activity. That includes ministers being present at virtual Select Committee meetings to answer questions on almost every aspect of our COVID-19 response. And to some extent, that is providing a greater question and answer opportunity for members of Parliament than would be the case if Parliament was sitting as normal. We are very mindful of the need for that scrutiny, and we're also very mindful of the need for Parliament to be able to come together sooner rather than later. So the government's view is that we should explore all opportunities for Parliament to be able to meet virtually rather than travelling here to Wellington at the current point in time. And we will work with the Speaker and the Business Committee to explore all of the ways that could be done. Other parliaments around the world have used remote meeting technology to allow them to continue to undertake all of their functions whilst restrictions are in place, and that is something that we'll be actively exploring here in New Zealand. And we'll do that through the Speaker and through the Business Committee, and of course we will aim to reach a consensus on that if we can do. And I ask simply that all other parties participate in that process constructively. Now open up for questions. Mikey.
Minister, Pacific medical providers say that they've been operating some of the vaccination centres from the beginning, but that they told the Ministry of Health they needed to be going into churches and they wanted to see things like group bookings. Why was their advice not taken on board?
I don't necessarily agree with that. In fact, I've heard reports of where Pacific health providers have gone into church congregations in the weekends, for example, and offered a pop-up vaccination clinic after a church service. Obviously not in the last week, but I am aware that that has happened up until now. So, look, I'm happy to look more at the who's raising the concern and why they're raising that particular concern. But we've seen examples of where that's already been happening.
Are you confident, though, that it's been happening on a large enough scale and that there has been trust towards the Pacific medical providers to be able to engage with their communities in the best way that they know how?
I can absolutely confirm that we have good relationships with our Pacific health providers, our Māori health providers, and that now that we're getting into the point where we're making vaccines available to just about all of the population, next week it will be available to all of the population, those sorts of pop-up events where there are gatherings of people, at such time as those gatherings are able to resume, will be able to become a more integral part of our vaccination program. Jenna?
Why are COVID positive cases having to wait to get into the jet park, and what are you doing to monitor those who are having to isolate at home?
There is capacity at the jet park at the moment, so there may be some logistical considerations around that, but we have capacity at the jet park to be able to accommodate positive cases. So it will be a public health consideration rather than an MIQ consideration that's driving that. We are also currently in the purpose of readying another facility to take quarantine people in the event that we need that, and it is looking likely that we would need that given the number of cases that we're seeing. So we're preparing that facility now so that we will have those rooms available if case numbers continue to grow.
On the saline issue, why did you not contact those 732 people who got the jab that day before it broke in the media? You've had more than a month to contact them and have not heard anything from you. Is that good enough?
Yeah, 2 points just to reiterate. The first is that there was an immediate interview done with all the vaccinators, and none of them could think of anything in their process that might have explained the leftover vials. So it was not clear that, in fact, anyone had missed out. So there's been a thorough investigation into that in the meantime, not leaving it to chance and making changes anyway to rule out the possibility that could happen again. But the second was just that then what the expert advice was to actually do in this situation, and we've been seeking that advice, working closely with the DHB up there. Minister, if I could just add a point on to the previous question. The reason for the delay is, you can imagine, with 40 or over 60 cases, part of the issue is safe transportation of people to the managed isolation or quarantine facility as well. So it would be a transportation issue. Sorry, and the second comment is just an update on Warkworth. As it's been confirmed, there is a positive case who lives in Warkworth that is likely to explain the positive wastewater there. Sorry.
We'll come to Jane and then Joe.
At what point was the decision made to send those letters out to those people?
Look, it will have been made now that the news is out, but
since RNZ started making inquiries.
Yes.
Why not for?
Just as I explained just earlier on, the key reason here is we were waiting for advice from our clinicians on the best way to deal with this particular situation. And I do want to point out there was a range of views. Some felt because there was actually quite a low possibility that 5 of those 732 people may have got either saline or a diluted dose of the vaccine, that actually, because there was quite a lot of uncertainty, there was no need necessarily to do anything. So we were waiting for our firm clinical advice on that.
Was there a decision made? Was there a discussion about not going public? What was the upshot of that discussion, and was there ever a decision made not to go public?
No decision had been made. As I say, there was a range of views. We had been involved in those discussions, and quite a lot of discussion between the Ministry and the DHB based on the emerging evidence from the review that was being undertaken.
Any time over the last 7 weeks, even if there's a possibility that 5 people are walking around thinking they're not vaccinated, and say, look, there's a problem, we're going to put the date out, we're going to put the centre out so that people can be aware. Mm-hmm. And also the lapse of time in actually giving people a day. I mean, why did you not take that approach? If you weren't sure whether people were vaccinated or not, wouldn't it be to err on the side of caution to go public and tell people that they may not have had?
Indeed, these were all the issues that were being canvassed, including with expert clinical input. So on that day, 421 people were actually receiving their second dose and 311 their first dose. Since then, 286 of that 311 have had their second dose. So virtually everyone in this group has had at least one, if not two, and it may well be that all of them are fully vaccinated. So we were looking to see what other jurisdictions like Queensland had done in this instance and awaiting our expert advice.
If you hadn't broken the story today, would those people have been contacted?
Yes, that was always the intention.
Joe.
Just on the Crown Plaza investigation, we know that the family that contracted Delta from the Sydney returnee, the door opened, the family adjacent ended up contracting it at some point between August 7th and 9th when the Sydney returnee was still there. That family then went for a walk in the exercise area on August the 12th. Do you know from CCTV footage whether any members of the public were using that walkway, which does not have a lid, it is the same airspace as the exercise area? And if so, have you identified those people?
So they've done a fairly thorough review of anybody who may have potentially been at any place around the jet park at any time when there could have been risk. And they have been contacting and ensuring that people are being tested.
I'm not talking about jet park.
Oh, sorry, you're talking about the jet park. Sorry, I'm talking about the Crown Plaza. Yes.
Jet park.
Yeah.
Okay, so...
Sorry, did I say jet park? I meant Crown Plaza.
So just to clarify, you don't know whether anyone was using that walkway that uses the same airspace when that family, who were already positive because they had picked it up from between the 7th and 9th, on the 12th, they were using the exercise area. You don't know if any members of the public were using that walkway at the time?
There has been a very, very thorough case investigation around everybody who was in or around the Crown Plaza at any time of risk to identify anybody and to identify who they are and make sure that they have been tested. On the walkway in particular, I'll ask Dr. Bloomfield to provide a comment.
I don't have any specific information, but we can come back to you on whether the CCTV footage of that specific incident where the members of the family from the room next door were exercising, whether there was anyone using that walkway.
Lastly on that, given your announcement today that you are going to do the day 6 testing, has that been triggered by the fact that this particular family has been able to use the exercise area during the period that they were obviously positive? Is that why you've decided to put in some day 6 testing?
We'd made that decision already.
Yeah, the day 6 testing is something we had been looking at anyway, but I'm just saying that what we're doing is bringing it in now because we have seen this incident of in-facility transmission. We've had them before as well, and it's quite a gap from the day 3 testing through to day 12. And so this just gives it may or may not pick up any infections if there's in-facility transmission, but it's just another slice of cheese in our line of Swiss cheese slices.
Derek.
Do you have an update, Dr. Bloomfield, on what Dr. Malcolm yesterday said the number of close plus contacts are and how many of them are still be contacted and whether any of them are outside Auckland?
Right, I can't answer the latter, sorry, but we can come back to you on that. As of this morning, there were 461 very close contacts. And of those 400, 87% we had had a conversation with. And there was a testing result because it was due on 289 of those people. So far, 68 positive and 221 negative.
Do you not know if they're outside? Does the Ministry know if they're outside of Auckland, or if there are any outside of Auckland, or we're still trying to ascertain that information?
They will know. I'll just need to get that information. I've just got one page out of a very long report.
Are you
in the front here?
A life-saving kidney transplant's been cancelled in Auckland tomorrow as the DHB doesn't have enough nursing resources. Is that good enough?
Yes, so a person emailed me yesterday about this, and I responded to him last night, actually. And my Chief Medical Officer, Dr. Connolly, has picked that up this morning with the DHB just to talk through and see. What I do have confidence in is that the clinicians making the decision will know whether or not that procedure needs to be done urgently, given that we're in alert level 4. I have every confidence they will, but we're just following up on that one with the DHB this morning.
Do you think... Is a kidney transplant ever not urgent?
Most kidney transplants are done as an elective procedure, whether it's actually they're done urgently if it's a deceased donor. But many kidney transplants are a live donor and usually a related donor, and those are very much a planned and booked exercise.
Are you concerned that our hospitals are at breaking point when it comes to this urgent care during the level 4?
Actually, because the hospitals have all wound back, and in most cases completely stopped elective surgery and elective appointments, or are doing outpatient appointments virtually, there is good capacity within our hospitals. So saying, in the Auckland region, at both North Shore and Auckland, they did have those challenges of those early cases, and so a number of staff had to be stood down. And likewise, a number of staff are affected as close contacts because they've been at a location of interest and they have to be stood down. So that is creating pressure, but I'm confident that the staffing is available to make sure urgent care can be provided.
Yes.
It's taking 2 to 5 days, as I understand it, to get a nasopharyngeal test back now. There's almost no evidence of APHG doing any saliva testing, and in fact the evidence seems to be that they're finding that's a slower process because of the way that they process the saliva samples. There was discussion last week of involving private sector saliva providers. There appears to be no progress on that. What is going on with saliva testing? What is the problem? Does the Ministry of Health actually want saliva testing to occur?
So in terms of the processing of the nasopharyngeal swabs, yes, there was a bit of a delay in getting through a backlog in the context of a massive surge in the number of tests. That has been cleared, more or less cleared now, and they should be getting back to a 24-hour turnaround for the nasal swabs. They've also got systems in place to ensure that where urgent swabs are required, so where someone is a particular person of interest and we need to get a rapid result back, they can get a result back faster than that. In terms of the saliva testing, it is being rolled out now for our frontline border workers. Not all of them have access to it at this point, but many do, and there are, I think from last count it was about 400 workers have opted into that, bearing in mind they get a choice between a saliva test twice a week or a nasal pharyngeal, a nose swab once a week. So about 400 plus people of those who are currently eligible and able to access it have opted in and will be doing that regularly.
The level of sense of urgency about saliva testing whatsoever. It was discussed last week as a possible source of surge capacity. Where have those discussions with private sector providers got to? We've got Waipirara setting up with a private sector provider now. What's the problem?
I'll ask Dr. Bloomfield to comment on that, but one of the points that I will make is that the processing of a saliva swab versus a nasal swab is as long, if not slightly longer.
Just two additional comments. It wasn't in my notes, but I do want to point out that there were 49,745 tests processed yesterday in our labs across the country, Waiana our largest number ever. So that has cleared what was a bit of a backlog, particularly any that were more than 48 hours. And I can say my team is in ongoing active discussions with more than one private provider of saliva testing, and I had asked them to progress those urgently to see what could be got in place in case we were needing to draw on that in the current context.
Are you happy with the number?
Dr. Bloomfield?
Sorry?
Do you actually have confidence in saliva testing? The Ministry has accepted
yes.
that it's as good as nasopharyngeal.
Yes. Yes.
Why are you so resistant to it?
Not resistant. I do have confidence in it. That's why we're rolling it out in the border settings and also looking at where it could be rolled out in other parts of the country, including, for example, with surveillance testing of healthcare workers in our hospitals.
Okay, we'll come up the back. Up the back.
Has the government received any advice, or are there any concerns about Aucklanders travelling up into Northland or around Northland at the moment?
I haven't received any specific concerns about that. Law enforcement are working hard to make sure that people are only travelling for essential travel, and that's our message to all New Zealanders. You should only be travelling if that is essential travel. The movement between Auckland and Northland is one of the things that we will consider in making future decisions if we were to have a land-based border at some point in some part of the country. We certainly have active conversations about that. We'll come down here.
It's back on the Crown Plaza. Forgive me if I'm relitigating this, but I mean, MB appears to be, I believe, is saying that the setup there in the atrium is now being extended and sealed. You know, this sort of rebuilding it. Why was it the way it was in the first place? And is this an acknowledgement that it wasn't actually up to up to par?
So what I can say is that all of the infection prevention and control audits that have been done of the Crowne Plaza have not raised any issues around the Perspex barrier. So there are two thoroughfares or walkways that are in question here. One is through the atrium and the other is the alleyway down the side. In terms of the one through the atrium, there was a Perspex barrier in place. My understanding is that there was a gap between the top of it and the ceiling, not a particularly big gap. Work is underway now and should be completed tomorrow before anyone else goes into the Crowne Plaza to close that gap off. But part of that, though, is then testing the air conditioning systems to make sure that air isn't transferred through the air conditioning systems between those two areas. And so that work is being done at the moment. So before anyone else went into that facility, that would be clear. In terms of outdoor spaces, the fencing guidance for managed isolation facilities is that any area where there's members of the general public and any area where there would be returnees, people from an MIQ facility, there needs to be at least 2 lines of fencing, 2 metres apart, one of which is that the interior line of fencing needs to be 1.8 metres high, and the exterior line of fencing needs to be at least 2 metres high. The exterior line of fencing is also covered, if you like, to provide privacy into the MIQ facility. Given that they are outdoor spaces, the public health advice we've had is that mitigates the risk of people being on the outer side of the outer fencing, being at risk from those who are on the inner fenced part.
That's very well and good. Do you accept that the previous setup was not suitable though?
Like I said, the infection prevention and control audits had not raised this as a concern. There is still no evidence at this point that there was transmission from one side of the Perspex to the other. But look, we are doing everything we can to make sure we're mitigating every risk possible. At this point, we still do not know what happened at the Crowne Plaza, whether it was even at the Crowne Plaza that there was transmission from our potential source case and other people. So we keep running down every potential avenue and every potential possibility. I'll have one more question, then I'll start coming back around the back.
Labour Party volunteers, are you disappointed that they continue to distribute Labour Party materials?
I know the Labour Party has been going to great lengths to contact every individual volunteer who has some Labour Party leaflets that they were given pre the lockdown to remind them that they should not be delivering those during the lockdown period. I know they have been working very, very hard to ensure that every volunteer who has leaflets knows that they should not be delivering them at the current point in time.
Can you just give us an update on the status of the quarantine facilities? So how many more beds are there in the jet park, places in the jet park? And what is the maximum kind of capacity of quarantine facilities that could be stood up in the country in the event of a massive outbreak?
So we have, as at last count, I think there was around 70 beds still, or 70 rooms, I should say, still available in our existing quarantine in Auckland, and a different capacity around the rest of the country, but Auckland is obviously the area of primacy at the moment. An additional facility with several hundred extra rooms is being prepared so that we can activate that within the next day or two in the event that we need to. Just remember that there is not a direct correlation between cases and rooms. So we are seeing multiple cases within the same family bubble, and in many cases they share a room, so that allows us to maximise our use there. In the event that filled up and we needed to repurpose another one of our MIQ facilities for quarantine, then of course we could look at that. We have to balance that up against the pressure of travellers coming in and our need to accommodate that safely. One of the reasons that we're not releasing any further, re-releasing any vouchers from cancellations at the moment is we just want to make sure that we're not over-committing our MIQ facilities when there is this extra pressure coming on domestically.
Most of the staff for the quarantine facilities are coming from MIQ. So there's a direct relationship between the capacity of MIQ, MI I guess, and the Q.
Yeah, so the quarantine part does require a more intensive level of staffing than the managed isolation part of our operation. So one of the key transitions that has to happen when we turn an isolation facility into a quarantine facility is to upstaff it so that there are more staff there to make sure we can provide that higher level of care and support to the people who are in it. I'll let you one more and then I'm going to move around.
The quarantine facility has been stood up. Is that the absolute limit of quarantine rooms that New Zealand could stand up?
No, well, theoretically we could continue continue to repurpose other MIQ facilities, but then we have to balance that up against the fact that we have pressure coming in of people who have vouchers booked to come into the country. Jane, and I'll
Are you satisfied or happy with the way the Ministry has dealt with the Highbrook vaccine situation and the level of transparency you've shown over the past 7 weeks?
Look, I don't really have anything to add to what Dr. Bloomfield said. I'm aware that there is still some question mark as to whether there is any risk here, and in fact every one of those people could have been fully vaccinated, and in fact the workers concerned, I think, are very diligent. These things do happen. It could simply be a recording issue here. So I don't really have anything to add to what the Director General has said.
Whether you're happy with the level of transparency that's been shown and the fact that you were not alerted, given the amount of discussions, reviews, investigations over this case?
Yes, I am comfortable with that.
At this point, are you clear on whether anyone has been infected in level 4 outside of the household?
Sorry, run that. But
so post level 4,
yes,
infected, but not inside a household, which we don't kind of happens, but in another setting, say a supermarket or a pharmacy, something like that.
I might ask the Director General, we are sort of in the process of going through on a daily basis now and trying to give people a greater sense of whether the new cases we're seeing are from outside of a household bubble, from a location of interest and so on. We are still seeing some cases from outside a household bubble but from a location of interest, but that most of that would predate the level 4. I don't know that we've seen.
It's not clear at the moment, but what we're doing, I've got a team who are going through all the data on locations of interest, looking at the links between people to build that picture so that particularly by the end of tomorrow, we've got a really good picture of whether or not there may be people who have been infected in the alert level 4 state, because that will be very important information for Cabinet's decision.
I do want to sweep through the room, but I'll let you. You haven't had many questions, so I'll let you.
Determining the physical distancing guideline that was established during the kind of alpha phase of COVID, is it up to scratch given how much more infectious Delta is, given the kind of weird infections we've seen happening in time?
When we established the 2 metre guideline, if you like, it was before we were requiring people to wear masks when they were out and about. So extra protective measures have been put in place during that time.
Maybe a short question. Is it okay? Doc says no, but the police are kind of turning a blind eye to it. People shouldn't really be out white baiting. It sounds a lot like a recreational leisure activity to me.
On behalf of a colleague minister, are you worried about cyber security given all the extra devices sent out in learning from home, and what extra is being done in this space?
All of the extra devices that are being sent out by the Ministry of Education are connected up through the Network for Learning, so they have extra security measures, extra filters put in place. For families who are connecting their kids to learning at home, Network for Learning are providing security screening measures that families can access for devices that they own as well. So, look at what the Network for Learning have to offer. If you're a parent that's worried about that and you want to make sure that what your kids are doing online, both now during the lockdown and at any other time, you want to make sure that that's safe, work through the Network for Learning. They've got some great tools and they are freely available to families.
Are you happy with the number of tests that you've got back from contacts, and do you need 100% of test results back from those contacts before we start looking at any sort of move through alert levels?
Well, the list of contacts grows every day, and so we will never be in a position where we've got 100% of results back. What I am satisfied is that the ones who are the very close contacts, the household contacts or workplace or so on, we have got isolated, and that we have got tests back on many of them, and that the others will be coming through. Sorry?
Only 62% tested.
Yes, and that will reflect 2 things. First of all, the timing of the testing, because we usually wait until that day 5 if they're asymptomatic. And secondly, they may only just, a number of those will have only just come in as very close contacts.
Better prioritise the testing stations from the get-go and made sure that contacts and symptomatic people were tested before the worried well.
Well, we certainly endeavoured to do that, and our messaging right from the start was very clear on a daily basis about who it was we needed to be tested and asking those who didn't need to be tested not to show up. So we've made every effort to do that. And likewise, for the last few days, we have had these restricted access testing centres in Auckland that have been specifically designed to get to people who are part of existing clusters or associated with existing clusters.
Mark and then Amelia, and I'll keep working my way to the left.
Dr. Bloomfield, you mentioned yesterday that you anticipated in preparing for Delta that there would be a surge in the number of contacts out there, but that this was 10 times the size of the August outbreak. Were you implying that the preparations for Delta didn't entertain an outbreak that had this many contacts and this many locations of interest this early on?
Two comments here. First of all, there are a lot of locations of interest, and you never know quite when you get that first case just how many other cases there are at the time, and indeed how active they may have been. And we've seen, and you'll see from the demographic description of this outbreak that there are a lot of younger people. We saw that right from the start. So that's one thing. I'm not saying we weren't prepared for that. But the key thing is that right from the start, the Auckland Regional Public Health Service took a very inclusive approach to describing people who, up until now, we would have considered casual contacts. It would have just been stay home, get a day 5 test. But in this instance, and then release, in this instance, we've categorised nearly 20,000 of those people as close contacts. So I think it was the right thing to do, and it was part of our response to Delta, was to be inclusive. But it has meant, of course, that we have got many, many more people who we are following up on a daily basis for a longer period.
Did you do enough to prepare the contact tracing system for an outbreak like this? Dr. Viral, now Associate Minister Viral, recommended in April that we should be able to trace 1,000 cases a day. We have 210 in 8 days, and it's still a bit of a struggle.
Yes, I think the recommendation from Minister Viral back in April and April last year was very much about based on what we knew about the virus at that time, and clearly Delta is almost like a different virus. And I think I'm confident we had upped our preparations and scaled up our contact tracing ability. But of course, you never know quite how quickly things are going to unfold until you're in it. We have got good contact tracing capacity now, and have had from the start, so we will be able to track down all these people.
Amelia, it's like a different virus. Why wouldn't we have prepared for perhaps even more cases and even more contacts of those 1,000 cases a day instead of less?
Yeah. Well, the preparation was ongoing at the time.
Amelia.
Thank you. Is the elimination strategy a long-term viable option with Delta, or do we have to accept a level of infection eventually?
I think if you look back to what we were talking about just a few weeks ago through the workshop that the Prime Minister led around reconnecting New Zealand, we are looking beyond doing everything that we're doing now on an ongoing basis. Things will change. They'll change with higher rates of vaccination, not just here in New Zealand, but also around the world. They'll change as new tools come into being, such as our ability to better enforce vaccination and pre-departure testing through greater international standardisation of those processes, for example. We're actively exploring, we are actively part of the conversations around making that happen. So I think New Zealanders at home who are saying, is this still the right strategy? It's too soon to throw in the towel. We've come this far. It would be an absolute waste for us to give up on this now. We still want to drive this particular outbreak of COVID-19 out of our community and get back to a sense of normality. You will see changes in the medium term in the way we manage the border, and of course we do want to get to the point where lockdowns aren't the answer to potential outbreaks within the community, but we're not there yet, and we're certainly not willing to give up before we get to that point.
And sort of separately, what indication can you give to businesses of what lower alert levels will look like this time around? For example, will level 3 be more or less restrictive than it has been in the past?
The alert level framework still remains the overall guide that we work to. Of course, from time to time there are the odd tweak to the alert level framework, and people will have seen that through our response so far. So yes, mask use will continue to be a greater feature as we step down and through alert levels. So will compulsory QR codes. Well, you can't call it compulsory QR code scanning, compulsory data, record keeping for contact tracing purposes. So that will continue to be a greater function. One of the things that we're working through at the moment is just we've not ever had so far in our response a situation where we've had a differentiated level 4, level 3 situation. We have had parts at times when we've had some parts of the country in level 3 and some in level 2, but we've never had level 4 and level 3 split around the country. So we're just working through what that means for supply chains and movement and so on, and extensive conversations going on to be ready for that in the event that that's where we get to at some point in the next little while.
And we're going to break away from the news conference now, but you can keep watching on our website, newshub.co.nz. Let's just recap those key points from the COVID-19 Response Minister and the Director General of Health. There are 62 new COVID-19 cases in the community today, bringing the total number in the cluster to 210. 61 of the new cases are in Auckland and 1 is in Wellington. The vast majority of cases in the cluster are either household or workplace contacts, and 12 people are in hospital with COVID-19. 11 of these are involved with the current outbreak, but none are in ICU. There are now more than 20,000 individual contacts related to the cluster, and there are 6 subclusters related to this outbreak, one of the largest being the Assembly of God Church in Mangere, with 105 total cases now linked to it. Dr Bloomfield has branded racist abuse directed at the Pacifica communities affected by the outbreak as disappointing and gutless. Wastewater samples taken from Warkworth in North Auckland have once again tested positive for COVID-19, and testing has ramped up in the area. Officials have confirmed a positive case has been confirmed there. Meanwhile, yesterday was the best day yet for our vaccine rollout, with more than 80,000 New Zealanders getting a jab. And of course, another very busy spot is the testing stations in Auckland. That is where Newshub reporter Alice Wilkins joins us now. Alice, we heard 62 new cases today, all but 1 in Auckland. Can we take anything from that?
Yes, well, we've been used to seeing this sort of small but steady increase over the last couple of days. What did we have? 41 yesterday, 35 the day before, 21 new cases the 2 days prior to that. So this is a little bit of a bigger increase than what we've been used to, but certainly not unexpected. And Dr Ashley Bloomfield reassuring there that a lot of these people testing positive are workplace contacts or household contacts of known positive cases. Modeller Sean Hendy had said that if we were to see cases start dropping off, the absolute best case scenario for that would be late this week. So today's number, although a little bit bigger, certainly not out of line with our expectations. And the good news, of course, that we're not seeing cases popping up across the country, for example, in the South Island or in areas where we weren't expecting them, and there are no known links to the current outbreak.
Yeah, definitely. And Dr Ashley Bloomfield there saying steady growth, but not exponential. There was also talk in the press conference about the saline vaccine mix-up. What's the latest with that?
Yeah, so this is the potential that perhaps 5 people who were receiving a vaccination at the Highbrook Vaccination Centre last month, July 12th, on a day where 700 plus people were vaccinated at that potential centre, were given not their dose of Pfizer but potentially a saline mixture instead. Now, Dr Ashley Bloomfield at length to say that they are investigating this, and at this stage they can't confirm that 5 people have been affected. It's a potential, and as many as 5 would be as far as that would go. Basically what's happened is it sounds like they've got to the end of the day, they've had 5 doses of Pfizer left over that are unaccounted for, and they don't know why they've got those 5 doses left. Dr Ashley Bloomfield says since that some changes have been made, so better labelling of vaccinations, and also some changes so that if we were to encounter this again, the number of people that might need to be contacted or recalled if they need to be vaccinated again would be much smaller, so it wouldn't be a case of trying to find the 5 people out of 700 plus, which it seems they are struggling to narrow down. It would be a much smaller number that they'd need to work with there.
And one of the most popular websites, especially in Auckland this week, will be that list of locations of interest. What is the latest with developments on that list?
Yeah, well, Melissa, we're approaching almost 500 locations of interest, the majority of those in Auckland. I think before midday we had 52 new locations that had been added today, and they were all in Auckland. The good news, though, is that among those 52 added today, a lot of them were locations we already knew about. So locations that had been listed, but perhaps this is just a new time frame or a new date. So we're certainly not seeing, as expected, with us all being in lockdown now, those large-scale events and those huge numbers of different locations right across Auckland, for example, that we were seeing in the first couple of days. So perhaps all eyes on those websites can slow a little bit.
And Alice Wilkins, thank you very much for joining us from a testing station in Auckland. We're now going to go to Wellington, where News Hub reporter Kaylee Callaghan joins us. Kaylee, another case confirmed in the capital. How are Wellingtonians feeling?
Yeah, Melissa, just that one new case of COVID-19 in the community here in Wellington, that takes the capital's total through to 12. Now, I guess there's a sense of cautious optimism that we're not seeing these cases spread. We're not seeing those large numbers come through in those daily updates, and most of these cases are all likely, as per the Ministry of Health, linked together. So I guess that's some good news for Wellington, that we're not seeing those big numbers. But I think for many people, if this is the extent of the cases coming up in ones and twos, I think many people will be pretty happy with that. Wellingtonians now, they're still sticking by the rules. They're not taking it for granted. We still are in alert level 4 down here, and we're seeing a lot of people out social distancing and wearing their masks and following along with those rules as well.
And Kaylee, are there any new locations of interest in the capital?
Well, look, no new locations of interest today for the capital. There has been an update. The last update for the Wellington area was for the 1841 bar and restaurant, so the exposure site on 17 August, for all staff and downstairs patrons to get a test on day 5 and day 12. For all upstairs patrons, they are to just self-isolate and monitor their symptoms over a 14-day period. The Ministry of Health do update that location of interest list roughly every 2 hours or so, so people are being encouraged to keep an eye on that website, especially down here in Wellington, if you have been to a location of interest, to follow that advice from the Ministry of Health.
Kaylee, how are businesses feeling in Wellington?
Yeah, look, mixed reaction from businesses, because we aren't seeing those big numbers in those community cases, but we are still in alert level 4. So I guess a couple of questions from businesses about whether we should still be in alert level 4 down here in Wellington. The other flip side to that is a level 3. That doesn't really change much. That's a concern for businesses as well. They really need to get down to alert level 2 to operate fully as well. But the other concern from businesses is around getting as much time as possible, as much notice as possible. We're seeing these extensions, 3 or 4 days of alert level 4 for places outside of Auckland. They want as much time as they can, some asking for as much as a week, just to get their ducks in a row and get everything sorted. But of course that can't be guaranteed, because this is such a moving situation with the Delta variant that I guess the government can't really give that guarantee to businesses.
Kaylee Callaghan, thanks for the update from Wellington. And I'll be here at 4:30 with the latest, and Mike McRoberts will be back at 6 o'clock with a full wrap of the day's developments. I'm Melissa Chan Green. Good afternoon.